even while trials were continuing, but no corners were cut on safety. The UK Vaccine Task Force pre-ordered hundreds of millions of doses from 7 different companies.
We prioritised the vaccine landscape quickly. We approached the various companies, and we were then the first to sign with Oxford AstraZeneca, with Pfizer-BioNTech.
In November came the first confirmation that a highly effective COVID vaccine was coming.
It's such a great day for science and humanity.
Soon, other impressive results followed, showing several vaccines were both safe and could prevent serious disease. Medical regulators here were the first to approve the Pfizer and Oxford AstraZeneca vaccines. And in December, Margaret Keenan became the first person in the world to receive the Pfizer jab outside of clinical trials. The vaccine rollout here has been a huge success, although a slowdown next month will mean the under 50s may have to wait until May for their first dose. At every vaccination centre I've been to, there is the same spirit of gratitude and optimism from those receiving their jab, me included. Thank you, Bruce.
You're all done, sir.
And ultimately, it is science we have to thank for giving us this route out of the pandemic. Preventing COVID-19 through vaccines is the ultimate goal, but effective treatments for those who fall ill are also vital. The NHS, more than any other health system in the world, has helped reveal which drugs work against COVID. Nearly 40,000 patients in 180 NHS hospitals have taken part in trials set up by a team at Oxford University. In June, they discovered the first blockbuster drug against COVID, dexamethasone, a cheap steroid, which cuts the risk of dying by up to a third. It's now the standard hospital treatment across the world.
As well as improving survival, it actually will decrease the number of people who need to come to intensive care.
Other repurposed treatments have followed, like tocilizumab, normally used for arthritis. But just as importantly, they ruled out drugs that didn't work. Coronavirus is here to stay. Mutations like the South African and Brazilian variants will keep cropping up. We'll always be playing catch-up against the virus. But the UK is a world leader in gene sequencing, meaning the spread of mutations can be tracked in real time. Booster vaccines are being developed, which will be ready by the autumn if needed. The goal of immunising all UK adults is now within reach, but vaccinating the world will be a far bigger challenge.